So I've gotten a lot of questions about what is the craziest and wildest surgery that I was able to participate or assist in or even do this surgery. I have another video about how many surgeries I did while in my training in residency, and I'll put that right up here. But in this video today, I'm going to be talking about the craziest surgery that I have ever done. What's up everyone, this is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. So, what is the craziest and wildest surgery that I had to do while in training? In training, we spend a number of months on different rotations. We do trauma surgery, we do hand surgery, foot and ankle, we do joint replacements, we do spine surgery, and also oncology. There's different disciplines within orthopedics. We spend a number of months doing surgeries with these particular surgeons. So on a hand surgery rotation, I will spend some months operating in the OR and also seeing patients in clinic with the hand surgeon. While on my trauma rotation, we spend lots of hours at the hospital, on call every 2 to 3 days, and then operating at crazy amounts of hours in the middle of the night, doing crazy cases from gunshot wounds to I had a patient come in after a plane crash, and had motor vehicle accidents. Patients come in after motorcycle accidents and their legs are missing because they've been amputated because of the injuries, gunshot wounds to the head, to the belly. I've seen a lot of crazy stuff during my time as an orthopedic resident. But the wildest and craziest surgery that I ever had to do was on my oncology rotation. So, orthopedic oncology is a discipline within orthopedics that deals with different tumors of the musculoskeletal system. So it can be bone tumors, it can be soft tissue tumors, it can be tumors in the pelvis or the hand or the foot and the spine. So all different types of tumors and different cancers. And there's a orthopedic oncologist that deals and takes care of these patients who have these different pathologies. So during our training, we spend about 6 months learning how to diagnose and also how to treat patients who have cancer of the musculoskeletal system. The tumors can be benign, which means they're non-cancerous, or they can be malignant, which means they're cancerous. So I remember during my intern year, during this rotation, is when we did this surgery, and for a young lady, a little kid, I think she was maybe 12 or 13, maybe a little bit younger, who had cancer of her distal femur. So usually when it's a tumor or cancer of the distal femur, it can be a number of different things, but usually osteosarcoma. There are several different options the way you can treat this. It's osteosarcoma, which can spread to different portions of the body. It can spread to the lungs, spread to different organs, and you have to be very aggressive. Usually we treat it with chemotherapy before surgery. We operate on the patient and they get chemotherapy after surgery. And a couple different options in terms of treatment, and I won't go into the specifics of this, but you have to remove that portion of the bone that has the tumor. And one particular surgery, it's the wildest surgery I've ever had to participate in, is when we remove that particular portion of the femur. Say for instance, this is your femur here, and then this is your top portion of your femur, this is the knee right here, and this is the tibia. So the bottom portion of the femur here, you have to remove that because it has the tumor. So you have to cut this portion out and you have to cut this portion out. Well, if you cut that large portion of a bone out, that patient's leg is going to be short. The patient will have problems walking, getting around. The patient's young, so you would like them to run around and be normal as much as they can. After the patient undergoes chemotherapy, and then you indicate the patient for surgery, decide which surgery you're going to do to remove this tumor and then reconstruct that portion of the leg. When you take out that large portion of the leg is short, you have to replace it with something. Sometimes you can do joint replacements, which means putting a long arthroplasty or stem inside the bone to make up for that loss of bone. Or what you can do is called a rotationplasty. This is the craziest thing and it may freak some of you out because it's not a procedure that is talked about a lot, but it is an option for some people who have cancer of their distal femur. During this procedure, we take out that portion of the tumor, and it's in a distal femur, and then you're left with a leg that's really short. What happens next is that during the operation, you turn the leg around and then you sew it back on backwards.
Huh?
Yes, backwards. So this is called a rotationplasty. It's been around for a while. It's been used to treat a number of different conditions, but usually in young kids who have cancer of their distal femur. In surgery, you have to be very careful that you don't twist the leg around where you're cutting off the blood supply to the leg or injuring the nerve. You have to be very careful after you take out that portion of the tumor, and then you turn the leg around 180 degrees. When this happens, this would allow the patient to have a new and functional leg that they can put into a prosthesis. So theoretically, the ankle joint of this limb is the patient's new knee, and then that portion can go inside of a prosthesis. And there's videos online where these patients are running around, they're having fun, they're doing things, playing sports, and they're living their life, something that they may not have been able to do without this procedure. So it's one of the craziest surgeries that I had ever had to participate in as a resident in training. I believe the surgery took about 3 to 4 hours, maybe longer. But yeah, it was a lot of fun to actually see the patient in clinic afterwards, and she was walking around. She was, not having much pain, and she was able to get around in her prosthesis. So that made me feel really good and about that particular procedure. So that's the craziest surgery that I've ever had to participate in. Let me know in the comments below if you're a scrub tech or you work in the operating room, if you are a physician assistant, nurse practitioner, or first assist. What is the craziest surgery or procedure that you ever had to participate in? Put it in the comments below. Love to hear from you. This is Dr. Webb. Thank you for watching this video. Make sure you subscribe. New videos coming every week. We'll see you next time.